Hi, it's Tim from ChiroUp, and this week's blog is about osteoarthritis and running. And the research is clear that running does not increase your risk of osteoarthritis. In fact, it may decrease your risk of lower extremity osteoarthritis. Lots of data to say that no increase in knee OA, no increase in hip OA. In fact, patients who run have lower incidences of hip replacements and also help for the spine, what you and I see on a regular basis. That constant imbibition causes the disc to become more hydrated, not less hydrated. So this week's blog talks about some tips that you can use in office, advice to give your patients as far as training, teaching them better mechanics for how to run, and the things that you can translate into actions for them to keep them healthier, to get them better quicker, and to prevent new injuries. Now, one concept that the blog doesn't talk about that I'm going to talk about here is the style of running, and especially what the type of foot strike is. That in the past couple thousand years, hundreds of thousands of years, when man has run, we've run on our forefoot. But recently, with the advent of more cushioned shoes, we tend to strike on our heels. And you think, well, haven't we always run on our heels? Because our normal walking pattern is heel to toe. But that's not our natural running pattern. If you think about how you run in your driveway, if there are rocks, or how you would run in the woods, you certainly wouldn't be running with a heel strike. You'd be running with more of a midfoot or a forefoot strike. And that's how we've learned to run, and that may be in a more efficient style of running. The bad news is most people don't run that way. They just speed up their walking pattern with the same heel strike. So I want to think about a couple of issues as far as energy efficiency and how we expend energy when we're running. That there are a number of things that can leach that energy. The one that we want, the only one that we want from this list, is propulsion. That when we're running, we'd like to move forward in a horizontal fashion. The other energy expenditure is vertical displacement. So in this case, how much time are we going up and down as opposed to going forward? And if I'm running 26.2 miles, I'd like to spend most of my energy going forward rather than up and down. Another energy leach is support, because anything that goes up has to come down and absorb energy and counterbalance that process when we're landing. So the more that we're going up with vertical displacement, the more that we're going to have to support ourselves on that limb. The other thing that seems like it would be of benefit is acceleration. That sounds good in a car, but we don't want acceleration beyond the start of a race. When we initiate from 0 to whatever our race pace is, we'd like that to be acceleration, but from that point in time, we'd like to avoid decelerating and accelerating. We'd like to keep that at a steady pace. The other thing is balance. The more time that we're spending balancing by compensating with our muscles, the more energy is wasted. And finally, limb movement. We've always seen that person who runs down the street that looks like a conductor with their arms, that they're moving all over the place. That's not probably getting them to the finish line quicker. So let's take a look at some mechanics that can help us spare energy. And let's talk about how forefoot or midfoot strike is very different from heel strike. That if we look at efficient running mechanics, number one, we want short, quick steps. That rather than taking long, lengthy, slow steps, we want short and quick steps. Somebody explained this to me one time as imagine you're running on the sun, so that your pace is 180 should be the cadence. That's an ideal running cadence, so that they're short and quick. And what that does is it changes the amount of energy that we're using and where we're putting that energy. That if you think about a long step, it's kind of like throwing the baseball from the outfield with a lob versus pitching. We don't want lobs, we want pitching. But if we're taking a long step, we have to jump to get to the next place that we're going. And that jump means that we're using energy on the arc, and it means that now we're landing with greater force. And we have to absorb that energy, creating more challenges to our balance and stability. We also tend to stop when we land on our heel, which then requires us to re-accelerate in order to move into the next jump. That's a lot of crashing, a lot of energy, a lot of problems. Versus landing on your midfoot or your forefoot, there's a natural shock absorber. So if we take a shorter pace and put our foot down more at the center of gravity, as opposed to way out in front of our center of gravity, we're going to use that natural energy absorption system. So when we land with a shorter stride, we're going to get dorsiflexion of the foot, which stretches the gastroc, storing kinetic or potential energy, allowing us then to immediately propel into that next step. That's a big difference between the long jump. Our legs will control our stride length, so we can determine with our legs, are we going to take a short step or are we going to take a longer step? And we want the short, quick steps. Our arms are going to control our pace at which the legs move, that those two are inexplicably tied to each other. So anytime I move my one arm, I'll move my opposite leg, and vice versa. That's how we walk and how we run. And the reason that we work so hard on our quadruped exercises and our cross crawls and the bird dogs, it's training that process. But our arms can control how our legs are going to move as well. So if we want to move our legs quicker, we move our arms quicker, but in the right plane. That ideally our arms would be at about 90 degrees, so that our hands are at about breast level. We'd also like to avoid crossing those arms over midline, because this is wasting a lot of energy twisting the body. So imagine that you're holding a ball when you're running. That ball is rolling back and forth between your hands, that your arms are going back and forth like the arms of a train engine. Your arms are going back and forward. So we want that to go back and forward throughout the entire run to help control that pace at which we're moving our legs. We also want to make sure that our hands aren't too tight. That if we're running with our hands gripped, we're wasting energy on grip the entire run. So imagine that you're holding a bird through the run. You don't want to let it fly away, but you also don't want to squish it. The thing that we want to concentrate on is allowing that power to come through the muscles that are made to go 26.2 miles or however many it may be. We're going to use the glutes and the hamstrings. That if you're a heel striker, you're going to land with a little bit of a bent knee and then quickly straighten that knee into hyperextension in order to propel you forward. That's the quadricep. That can do the job, and you know that the quadricep fires if you've ever gone out for the first run in a while. Your quads are sore. Whereas somebody who lands with a shorter, quicker step with their leg underneath their center of gravity, their knee slightly bent, their calf is taking a little bit of that, but then in order to power themselves forward, they're using the extensors of the hamstring and the glute. The glute's a very durable muscle that can handle a whole lot of that stress, so it tends to work out better, a little bit better endurance, especially if you're going to need those quads later, if you're a triathlete and you're going to use that on the cycle, or you've used that somewhat on the swim as well. So we'd like that patient to be powering from the hamstrings and from the glutes rather than the quad all day, a little less stress on the knee. We also want that foot to be moving backwards before it hits the ground. So as opposed to running with a long stride, there's no real way to have your foot moving backwards before you hit the ground. And that's where you hear kind of the skidding process. Well, think of the energy loss in that process versus allowing that foot to be underneath you, and it's already initiating the backward movement, a little flick backwards just before it hits the ground. And if you want to test this, go out on a gravel road and run. If you can hear yourself landing on the gravel each time, then there's probably some energy expenditure that shouldn't be happening. If that foot is moving back at just the right pace, now we can get that energy down, and it's going to be a lot quieter run, which tells us that we're preserving energy. And then finally, we're looking at core stability. That our core stability comes from some of the things that we talk about in this blog, as far as making sure that we're not running on a line. That so often patients have weak gluteus medius muscles. That muscle comes off the iliac crest and down onto the hip, and its job is to abduct the thigh, but in reality it doesn't do that. What it does is it holds our belt level when we take one leg off the ground, and it holds our knee in the frontal plane when we go to bend that knee. If we know that muscle is going to be weak, we do a couple of things in compensation, and that is if I know that if I lift this left leg, my pelvis is going to drop to the left, I'm going to compensate by leaning toward the right. Well, that's the same thing as just simply putting my right leg on a line as opposed to letting it drop out lateral from that line as it should. So that's one of the big things with core stability. The other thing that we're thinking about is what's happening to our gas pedal. That when we're running, the degree that we stand upright determines our speed. Think about a sprinter who is way forward versus a runner or jogger who's going to be more upright. When we push on the gas pedal, we're going to move quicker. And a lot of the way that we can control that is by where we're looking. Then in a race, if we're looking about 20 feet in front of us as opposed to too far up or too far down, that's going to keep our gas pedal moving in the right direction. So by employing these things, we can help limit the energy expenditure. We're still going to get propulsion, but we're going to have less vertical displacement, less need for support and balance, and we're not going to be accelerating and decelerating consistently. So I hope this is something that you can use in practice. One thing that we want to remember is that we and our patients need to transition slowly. that if they're used to being a heel striker, we can't transition them into being a forefoot or a midfoot striker in one fell swoop. It's going to be a slow process. And number two, there's an infographic in the blog that I hope that you'll download and share with your patients about mechanics and things that they can do to help keep themselves healthy. Hope this information helps. If you have information that can help me, love to hear it. Thanks for watching. See you next time.